Hey everyone, welcome back to the channel. Today we're going to be talking about a topic that affects millions of women. It's both often misunderstood. Endometriosis. Did you know that this chronic condition can even flare up during perimenopause? Stick around until the end because we're going to reveal what sagos and dark chocolate have to do with it. Trust me, you don't want to miss it. First things first, endometriosis affects around 10% of women globally. That's around 190 million people. But here's the shocking part. There's often an 8 to 10-year delay in diagnosis. Why? Because the pain associated with it is often dismissed as bad period pain. Let's clear something up. Chronic pelvic pain is not normal. If you or someone you know is dealing with this, please don't ignore it. Go and see your doctor for a proper assessment. So what exactly is endometriosis? Imagine the lining of your uterus, called the endometrium, deciding it doesn't want to stay put. Instead, it travels backwards through the fallopian tube into your pelvis. This process is called retrograde menstruation, and it's a leading theory behind endometriosis. This misplaced tissue can seed itself anywhere inside the pelvis and beyond. Yes, even as far as the diaphragm and around the heart. Incredible, isn't it? Now, diagnosing endometriosis isn't always straightforward. The gold standard, a pelvic laparoscopy. This is a keyhole surgery performed by a gynecologist to help them visualize endometriotic lesions inside the pelvis. Check this out. What you're looking at is an endometrioma on the ovaries, also called a chocolate cyst, because of its dark, thick appearance. It gets its nickname because it looks like a bowl of chocolate. And then there are these tiny sago-like spots. These are endometriotic lesions. See, I told you we get to sagos and dark chocolate, but let's get back to why this condition is so complex. There's no single cause of endometriosis. It's likely a mix of retrograde menstruation, genetic predisposition, immune system dysfunction, and environmental factors. Some risk factors include starting your periods early, having short or heavy menstrual cycles, and a family history. Once diagnosed, treatment depends on the individual. A laparoscopy can remove lesions and cysts, but long-term management is key. Pain management and hormonal treatments are often used to suppress ovulation and ease symptoms. These treatments include options such as the pill, the hormonal IUD, and medications called GnRH antagonists. But here's the catch. These treatments can trigger menopause-like symptoms. So doctors often prescribe add-back hormone therapy to balance things out. Now let's talk about perimenopause and endometriosis. This phase can be tricky because fluctuating estrogen levels can trigger flare-ups. Hormone therapy might be needed, but it has to be carefully managed. And if symptoms change or new ones pop up, it's super important to check in with your doctor. Endometriosis doesn't just vanish after menopause. In fact, 2 to 4% of menopausal women still have it. Some women opt for surgery to remove their uterus and ovaries, especially if they're dealing with severe symptoms. But if this happens before natural menopause, monitoring bone density is essential. One more thing. Women with ovarian endometriomas have a slightly increased risk, about 1%, of ovarian cancer, especially occurring between the ages of 45 and 49. That's why regular checkups are so important. The bottom line, endometriosis is a lifelong chronic condition that has to be managed through every stage of life. Whether you're in your reproductive years, perimenopause, or menopause, always have an open conversation with your doctor or your specialist about treatment options. Alright, that's a wrap for today. And if you like this video, please like, subscribe, and share it with someone who you think might benefit. And remember, whether it's sagos, chocolate cysts, or pelvic pain, knowledge is power. And a healthy lifestyle is a partner to medical therapies. So come walk the talk with the doc. Take care of yourself and see you in the next one.